The term autism is said to be a developmental disorder characterized by severe deficits in social interaction and communication and by abnormal behavior patterns, such as the repetition of specific movement or a tendency to focus on certain objects. Autism is evident in the first years of life. Its cause is unknown, as it's also said that there isn't any cure yet.
Autism is a neurodevelopmental disability that affects people in basically two domains. It used to be three, but now we've narrowed it to two domains: the social and communicative domain, and then the repetitive and restricted behavior or interest domain. So they are not really given to change or integrating with the rest of us in the way that we think they should, but in their own unique way.
Is a neurodevelopmental disorder noticed in a few people. At Cyclotron, we write for life, and whatever life means to different individuals. So in this case right now, if we say we write for life, some people write for networking, they write for friendship, for fun, and all that. So autism is one of those disorders that can inhibit the possibility of that.
Stigmatized in the society, and we find that many people do not really understand that this thing is something that comes some ways naturally and nothing you can do about it. And as such, people that come or are born autistic sometimes have difficulty integrating with society. You find times where you have little kids, where the kids are separate from their friends. They don't integrate much with their friends. They are very brilliant, but you find that they don't relate the way we are used to. So they have to find other neural paths to relate and to form conversation, especially in the area of communication. So they are very good cerebrally, but you find them difficult, lacking behind, especially in their age group in terms of communication.
In sensitizing the public, parents and experts spoke on their experiences with autistic patients.
A daughter who's 21 who has autism. She's in university, she's graduating. And so that's why we say once you identify it early and you begin to give them the skills, the relevant skills, they can thrive. Okay, they can thrive. And for families to realize that even if the child or the individual that is on the spectrum is vocal, because sometimes we meet the ones that can't speak, that they shouldn't relegate them. Teach them something. And that's what we do at Shades of Life. When we work with them, we actually give them the necessary skills that they need to thrive in society.
To accept it and see how to look at the positive outcome of it, or how to keep my family together, how to just be, to take a different turn and try to see the positive in it. And first, it started with me healing myself, picking myself out of my depressed state and stop feeling sorry for myself. And then I started to, with my immediate family, started to educate myself, started to open my eyes to how I can be there for my child, how I can advocate for better results for my child.
Preach early intervention when you notice your child does not maintain eye contact, does not have shared interest, does not point, does not respond to name. We say these things to the parents that when you notice these things, maybe you begin to think, don't think autism first though, but just know that there's actually something that, they're not meeting their milestones, right? So there's something that needs to be done to get them to begin to get those milestones together.
We noticed that some things weren't, it took us time anyways. I was like, what's wrong with this girl and all that. I'd been used to seeing my niece and nephew grow up, so I was expecting some things, but it took like 2-3 years to realize that something was different. We went to different people, sought different opinion, but what I think has helped, it took us time to realize that there wasn't anything particularly wrong with her. It was just us that didn't understand the way to approach issues with her.
They also gave their words of encouragement to individuals living with autism alongside guardians to those living with the disorder.
Families that are going through, We would like to have them get their children assessed properly and then get diagnosis, differential diagnosis. Even if they can't afford to get a diagnosis, the assessment is available. A lot of people can't afford it, but if we can all rally together, even as a club, a foundation that we also have, just to have people have access to this basic assessment, then they can begin to have intervention.
Right? So ignorance, a part of the word ignorance is a lack of information. So when people are not aware, you have Shades of Life, you have other organizations that can help them. Because yes, they might be different in that small group that they're in, but guess what? There are other groups that they can thrive, but they can even do way better than they anticipated. So get that information. Engage with Shades of Life, engage with other organizations that deal with autism, and allow them to help you manage it so you'll become more than a fully functional adult, a highly productive adult. Because one thing with autism is, they're highly functional in certain parts, right? And all you just need to do is help them tailor that and allow them to achieve their greatest potential.
Of us are one of a lot of people, and you're not alone in the world. And please understand that it's not your fault, and the society needs to understand that they need to accept people that are autistic and work and warm up to them and give allowance, make excuses and give allowance for them so that we all have a peaceful and loving world.
People living with the disorder should not be seen as insane, but rather as normal people, as the government and other principal partners or organizations do have significant roles to play in sensitizing the public, thereby bringing about a reduction in the rate of depression and suicide.